Well, hello and welcome to all of our viewers from around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, if you've been tuning in lately, you have heard me talking about our upcoming GOLD Lactation Online Conference, and let me tell you, we're pretty excited. We have been working very hard in the background, taking all your calls, registering folks, and of course, I've been working with all the speakers to get them ready, set up, and make sure that they have the best setup to engage with you at the live conference. Today, I'm so excited to have Dr. Carmela Baeza with me here today. Now, Kika and I have done quite a bit of work over the last couple of years, and it just excites me every time that she's here. I'm always learning so much from you, Kika. So thank you and welcome back to Gold Lactation.
Thank you so much, Fiona. I feel so honored to have been asked to do this specific talk. I'm very excited to share everything with you.
Well, I'm excited too, and we'll get into the talk in just a moment, but I did want to give you a little bit of a shout out because Kika is actually part of our Gold Academy as well. So our Gold Lactation Academy now has launched. That's the 95 plus hours. Not only is Kika a speaker, but she's also part of our professional committee over there who oversees the ongoing and up-to-date evidence-based information for all of you. So if any of you are aspiring IBCLCs or want to come and check it out, be sure to check it out over on our Academy platform as well, which is super exciting. And I know you and I, that's why we've had a lot of time to work together, because it's just been fantastic putting it together. And you've been such a great component of that. So thank you so much again for all your hard work, Kika.
Thank you for having me in your team. I've learned so much since I'm working with you. It's really exciting to be part of such a huge project. And I think, you know, to have this what the Academy is putting forward to help, you know, people around the world become IBCLCs, I think it's a huge value.
Yeah, absolutely. Yeah, we're excited to be able to have that accessibility to so many folks around the world, which is wonderful. Well, here we are. We're talking about our GOLD Lactation Online Conference, and I'm excited to say that Kika is going to be here as part of our keynote lineup this year, which means when every time you hear keynote, it means that that will be an open access and free content to all of you. So it means you can come and register for this event for free. There's no fee for you. You can listen to the live event. You can listen to the recording. Now, I know that when you come and see what's available for us this year for our Gold Lactation Conference, I know that you're going to want to come and listen to the entire event. But for those of you who are just tuning in to listen to our keynotes, you're very fortunate this year that we're going to have this fantastic topic by Kika titled An Ecosystemic Approach to the Clinical Management of Breast and Nipple Pain. Now, we had talked a little bit about this topic leading up to today's event, because it really is, I think, the big picture, you know, of what's happening. But perhaps you can tell me a little bit more about, you know, how you started formulating this topic and what really excites you about sharing on this.
Yes. For me, well, I come from a strictly medical background. I'm a family doctor. So at first my approach to, you know, our classical nipple or breast pain that we see every day at the breastfeeding clinics, well, it was a very medical approach. It's, you know, there's a wound, we have to heal it, or there's something in the mouth, we have to fix it, and that's it. No, but then you come to realize that it's not enough. That you know, there's a nipple, but then there's also a breast, and then there's also a rest of the body, and then there's also a person who has feelings and thoughts, and then there's a baby that's, you know, that's interacting. So just the medical approach or the local approach is just not enough. And then, you know, you realize, okay, I'm going to work with a dyad, you know, the mother and the infant, or you know, the whoever's, but then, you know, there's also the partner, and then there's also the family, and then there's also the other physicians who are taking care of this family. So you can't, it's impossible to attend to just the little picture. You have to, you know, then you start having all these new layers. And for me, the issue was, how do I manage or juggle, you know, all these different layers? So for me, what the ecosystemic approach gave me was a way to bring this together in a manageable way, in a useful way in my clinical day-to-day work.
Yeah, absolutely. And I think, this is something that is starting to come up more and more. It's really broadening our research, our evidence. We're reevaluating what we're doing in practice, how we're counseling. I mean, it's really sort of touching all areas, because it used to be very small, very direct type of care that we would do. And of course, you had a different model working as a physician, but yet not dissimilar to how I would even approach things as, an IBCLC, very direct, very small. And now I'm like, whoa, what is happening, Kika? We're really looking at so many different elements. We're also, I think what's really interesting is that collaborative care, same type of framework almost, that it's no longer this very narrow type of work that we're doing. And I think that it's serving a greater purpose. I mean, we know that often families are the ones that we are working with especially in that postpartum period. And so there's a lot to take into consideration. Were you surprised, at really how much, when you started looking at the layer after layer, how much there really was involved here?
I was very surprised because I mean, on the one hand, I was surprised because I didn't expect for them to be, so much. And on the other hand, I was glad because it kind of gave me relief to see, to understand why many of my interventions weren't working. It's because I wasn't, taking in all this whole picture, and, just my very precise surgical medical intervention was not enough.
Right.
And that for a doctor is not an easy thing to,
Well,
to admit.
But you're very humble. And I know that you're always looking for solutions, rather than, just trying to solve problems. And I think that, this is the bigger picture. This is what we can all do together, no matter where we are in practice. We can start to reevaluate what we're doing. And I think that's the key thing. The definition of insanity is doing the same thing over and over again. And often, that's what we find ourselves. And or what I find, Kika, and I don't know if it's the same for you, but I will talk to parents and mothers, and they'll come to me and they've seen several clinicians, and I'm really always curious. It's not all to do with education. It's just that there is this narrow field of work, and people miss things. So I'm really, I'm very excited about what you're doing, particularly for this talk, but I think collectively, I mean, can you imagine, Kika, what is going to happen over the next few years as we open up, our practice, as we become further educated? I mean, does it excite you as much as me?
Yes, I'm very excited. And all through the talk, I will share with all of you, like, the aha moments I've been having, as I grow in my practice, and those aha moments have always come from, from the parent, from the mother, from the baby, from watching them and saying, what are they telling me? How are they asking me for help? And how is my help lacking? And how can I grow in this care for them? And also, it's a road in which you learn to refer to other professionals, to create this network in which you say, okay, how can this diet benefit from, some physiotherapist or a psychologist, or, just whatever pops along as you see, as you walk, in that those few steps of their life paths with them.
Yeah, no, absolutely. I mean, the truth is our families are our greatest teachers in all of our work, and it excites me to be able to look at the bigger picture and see different approaches, because even myself, I know that I can get stuck in a certain belief or certain pattern of behavior. And I feel like I need to be pushed constantly to expand my knowledge, as well as just, for my families, to hear what they're asking as things change. Our families are really smart, Kika. That's the truth. Like, they are very smart. They come with a lot more knowledge today than they ever have. And so I'm excited to, expand out and see what we can do together, right? See what you're going to teach us. And of course, our participants as well, Kika. I mean, they have so much to bring to this talk too. It's going to be great interacting with them, and you're going to be here interacting, doing a live Q&A as well, correct?
Yes, and actually that's my favorite part of speaking here, of speaking live, is that then, comes the part, the first part is when I tell, and then the second part is when I learn, when I have this interaction with everybody, and you have to think, and I think that's the best part of our profession, that we push each other to learn more and more.
Yeah.
And the truth is, there is little research in breastfeeding. But I think also this like broadens our horizons, because it makes us look around, everywhere, to see how we can keep growing. And I think that's beautiful.
Yeah, absolutely. Absolutely. Well, you heard it here first. This is going to be a fabulous presentation. Come learn, enjoy, bring your questions, bring your thoughts, your ideas, bring what has really worked for you, and let's take it to a whole new level. That's the key thing. So thank you so much, Kika Baeza, for being with us here today. Your presentation title, An Ecosystemic Approach to the Clinical Management of Breast and Nipple Pain. I'm truly looking forward to peeling back those layers and taking another leap, in this amazing career. So thank you again for joining me here today at Gold Lactation. And thank you to all of you, our viewers, for tuning in. Don't forget to head over to the website right now at goldlactation.com. You can register for Kika's presentation is standalone on our website at goldlactation.com. You can also come and listen to the live and or the recording. And of course, registration is open right now for the entire conference. We'll look forward to seeing you all online. Thank you for joining me here today. Bye-bye for now, everyone.